Hello, microbiology students. We're going to start talking about the cardiovascular diseases by beginning with endocarditis. Now, the endocardium is the lining of the heart as well as the covering of the valves. And there's two kinds of endocarditis. One is acute, which means it comes on rapidly, and the other one is subacute, okay, which means it's a gradual progression. They both have the potential to be fatal, okay? Now, having damage done to your heart valves by injury or because of a congenital defect, okay, puts you at risk for developing endocarditis. So people who have like mitral valve prolapse are at a higher risk than somebody who has normal valves to start out with. Somebody who has rheumatic fever has had damage done to their heart valves and is at greater risk for developing this condition. Okay. Now, the symptoms are going to be fever, anemia, abnormal heartbeat, a murmur is possible where you can actually hear something with a stethoscope. Okay, it's actually like the blood flowing backwards because of the heart valve being defective. Heart attack symptoms, shortness of breath, chills, and then there are some signs that might show up. Janeway lesions are sort of reddened areas that are not raised, they're not painful. They show up on the palms of the hands and the soles of the feet. And also Osler's nodes, which are painful, which are like reddish bumps on the extremities. Okay, so these are sort of the result of my traveling immune complexes that are deposited into these locations. Now, subacute is going to be a more gradual process. If we talk about the acute endocarditis, we're really talking about something coming in from the outside and damaging the first chamber of the heart, that valve, okay, which would be the tricuspid, okay, and this is common to IV drug users because they're injecting dirty things, germs from dirty needles, and the first chamber that they get to is going to be the where the valve is going to be damaged. Now, and their symptoms come on quickly. Now, the subacute, usually they call it subacute bacterial endocarditis, and they abbreviate SBE, okay? Takes a longer time. And because it takes a longer time, you have a more gradual development of the signs of this. And so your spleen gets enlarged because you've had bacteria in the bloodstream. And remember, the spleen is the blood filter. It removes germs from the blood. And club fingers are the result of inadequate oxygenation of the blood. And the fingertips, okay, are going to get sort of bulbous, okay, and the nail is actually going to get curved down, okay. So it's not your nail bed usually is pretty flat. Well, this sort of curves around, okay. Now, Staph aureus, Strep pyogenes, Strep pneumoniae, Enterococcus, Pseudomonas can be causes for acute endocarditis, whereas the subacute is usually linked to the alpha hemolytic streptococci, the mouth flora bacteria. And so it's also associated with people who have dental surgery. It may follow a procedure where there is an opening in the circulation because of the surgery that's going on, and these bacteria get in, they travel through the blood, and they can cause an infection or vegetation to start growing on and this is usually mitral valve, okay? Now, the acute parenteral means coming in from outside the body. You can demonstrate its presence by doing a blood culture. You have to be careful with your surgeries. You have to be careful with IV injections. Okay, vancomycin works because these the agents that cause this, okay, are going to be gram positives primarily. Okay, and again, high fatality rate. Okay, acute. Okay, they are they usually advise people who are going to have dental surgeries, particularly people who have damaged heart valves, like from rheumatic fever, okay, to go on medication prior to their procedure, okay, and again, slower onset. Now, sepsis is a bloodstream infection, and this is going to be when the bacteria have gotten the upper hand and they're multiplying, and especially if it's a gram negative, it's going to have the endotoxins are going to have an effect. They're going to cause a elevated temperature, altered metals, shaking, chills, okay, fever is accompanied by chills, GI symptoms, rapid breathing rate, okay, blowing off of carbon dioxide, so the blood gets more alkaline as a result, and the blood pressure drops because of the endotoxin shock, okay, and so sepsis is, again, a very critical situation and causes a lot of deaths in the hospital setting. Endotoxin shock, lipopolysaccharide, the outer membrane of gram-negative bacteria, even if the germ is dead, the debris from that cell wall material still has a toxic effect. And again, it causes the fever reaction, it causes vasodilation, leaky blood vessels, increased permeability, edema, okay, blood pressure drop, and also triggers a cytokine release. So you have this, what they call a cytokine storm, where all these chemicals are acting on things that normally regulate your blood pressure, and your blood pressure plummets. Because of that, your organs are not getting enough oxygenation, and so you're going to have multi-organ system failure. Okay, and it can also be caused by gram-positive bacteria. Now, we just had a report that a man died of plague in, I think it was Arizona. It can also happen in the Four Corners region of the Southwest, okay, New Mexico, Arizona, Colorado, I forget what the other one is, okay. There are the ground squirrels and the prairie dogs that are the reservoir of infection. This is a zoonotic infection. So it's going to come from an animal reservoir. It's transmitted by a vector. The vector happens to be the flea, okay? And it also can be transmitted person to person or infected animal like a cat to its owner by breathing, okay? So we have three forms of it, okay? Pneumonic plague is a respiratory disease, okay? And it's airborne, okay? Bubonic plague is the result of getting a flea bite, and wherever that flea bit, okay, I think it defecates, and in the poop, okay, is this bacterium, and people scratch it. It gets into the bloodstream, and it goes to the local lymph nodes. So if you're bitten around the ankle, it's going to go up to the groin area. It's going to cause those lymph nodes in the groin to enlarge. Now, they can get to be swollen with pus, and that swelling of the lymph node is called a bubo, okay? And it can actually rupture, okay, because of the amount of white blood cells that invade that area. The reason that you have all these white blood cells is that there's an anti-phagocytic virulence factor, plus the fact that it has a capsule. So your white blood cells are not able to destroy it, but it's still there. It's still recruiting more neutrophils to the area. Okay, now the mortality rate, even if you get an antibiotic, there's no guarantee you're going to survive. Okay, um, so 15% of people, even if they're treated, we're going to die from the plague. Untreated, the rates go much higher. Now, if you get bubonic plague and you have it in the bubo, it may also then get into the bloodstream. And then this is going to, again, gram-negative bacteria in the bloodstream. It's going to trigger endotoxin shock, intravascular coagulation. You're going to have hemorrhaging. You start off with these little bleeds called petechiae, and then you have these massive purpura. Okay, it's bleeding under the skin, and that purple area ultimately will result in necrotic tissue and gangrene. So that's why they call it the Black Death. Okay, because the tissue blackens. Okay, because of the effect of this on the circulatory system. And again, if you have septicemic plague, okay, even with treatment, you have a 50-50 chance. And if you're not treated, okay, you're going to die. Okay, so the virulence factors, and this is a bacterium that's actually in the same family as E. coli and Enterobacter, but it really doesn't behave like that at all. Okay, it has a capsule. It's able to activate plasminogen activator. Plasminogen activator activates plasmin, which starts breaking down blood clots, so you're going to have hemorrhaging as a result of this. And it also has these proteins, I think they call them YOPs, Yersinia pestis outer membrane proteins, that interfere with the host responding to the inflammation. Okay, so it's actually sort of sabotaging the host defense systems. Okay, it's a very successful pathogen that way. So here is a bubo. Obviously, this person was bitten by a flea around the ankles, and so the lymphatic fluid flows up here to this lymph node, and then the white blood cells aggregate in this area, and it gets bigger and bigger and bigger. Supposedly, the bubo can be the size of an apple, and it can burst. Okay, now the part of the Southwest where you have it, the Four Corners area here, these are the 4 states that have the greatest incidence, but you also can have it in other parts of the West. Okay, so when you go to the Grand Canyon, they have warning signs all over not to go near the ground squirrels, because the ground squirrels can have fleas and they can transmit the plague. Okay, a lot of owners, cat owners in the Arizona region, have to be careful. Their cat goes out and into the desert, and they chase an animal that's sick, and they have a greater chance of catching the animal, okay, because the animal has plague. Now the cat comes home, and the cat doesn't feel well because it has been infected, okay, by the dead animal, okay, and then the cat owner takes it to the vet, and the cat, meanwhile, is breathing on everybody, and the vet techs and the vet and the owner can now develop the pulmonary version of the plague. So, if this has there's urban plague, which usually is in the city, and it's usually associated with what they call the Norway rat, okay? And then there's sylvan plague. Sylvan, like Pennsylvania's Penn's Woods. It's the wood-like area that we're in. And so we have the mice and the ground squirrels and the prairie dogs and the chipmunks. These are all reservoirs of infection. So they have outbreaks. They have, they don't have an epidemic. They would have an epizootic, okay, outbreak. It would happen in the animals, and you start seeing all these animals dead, okay, and it's an alert that you have to be careful. So veterinarians are really the front lines that get to see plague. So this man here has been bitten, okay? And he has, well, here's under the arm, those lymph nodes can, if you're bitten on the arm, it's going to travel to that lymph node. Bitten on the leg, it's going to travel to that lymph node. And then once he develops it, it can get into his bloodstream, and then he breathes on his partner here, and she develops pneumonic plague. This is what took out so many people in Europe. They had a very dense population. They had lots of rats, especially in the urban areas. And so huge numbers of people died from it. They don't even know actually what the death count was precisely. But it really altered the history of Europe having this Black Plague. So this is a good summary here. Now, when I was a little girl, my mom warned me not to ever go near a rabbit that was sick or dead. Okay, of course, I thought she was crazy. Okay, but she grew up in a time where there were no antibiotics, and occasionally people who were hunters would get this rabbit fever from the prey that they had caught. Okay, and so she was aware of it. It was something that people knew about in the old days. Okay, more than today. They actually had cases that in Gloucester County, somebody had been hunting for rabbits, and then he took the rabbits, gave it to his neighbors who actually liked to eat rabbit, okay, and they butchered it and had one for dinner that night, and the others went into the freezer. Well, the next thing you know is the lady that did the butchering died, and then her husband got sick also. Now, the hunter had developed a sore on his hand, okay? He had a skin lesion, okay? And went to a emergency room, was treated with an antibiotic, and that was the end of it. But the lady developed a systemic infection, okay? So you can actually get it from eating contaminated meat or by touching an animal. They call this often, it occurs in landscapers. They call it lawnmower tularemia because they have one of those big machines that lawnmowers, and they cut a field, and it's so high in the grass they can't see what they're going over. So there's a dead rabbit there. They hit the dead rabbit, and the dead rabbit becomes confetti in the air, and the guy that's the landscape breathes it in, and the next thing you know, he has pulmonary tularemia. Okay, so it can happen. Okay, it can be treated with streptomycin or gentamicin, which are aminoglycosides. Okay, again, and you also can get it from ticks. Okay, as well as from contact with the animal that's infected. Now, this is a bioterrorism weapon agent, okay, because it has a very low infectious dose, okay. It's transmitted by air, okay, and they've done research on this, okay. Some people say it was to protect people against it. Some people say, well, maybe they were going to consider using this as a weapon, but they have done bioterrorism studies on rabbit fever because of its high virulence, okay. Now, when I was a kid, I've never heard about Lyme disease. In fact, it really wasn't here in the United States until the 1970s. They think that there was an island off the coast of Connecticut where it was present in the deer population. And then somehow the ticks, either in the larval or the nymph stage or the adult, traveled to the mainland and started spreading on the eastern seaboard. Okay, now there was this lady who her son developed rheumatoid arthritis, swelling of the the knees, okay? And so she takes him to a rheumatologist, maybe at Yale, okay, and looks around the waiting room and sees all these kids from her neighborhood. And she puts two and two together and she thinks maybe there's some kind of a cluster. And so she actually goes and, because she doesn't understand why the son has this rheumatoid arthritis and why so many kids in that area have it. So she wants the researchers at Yale to sort of investigate this case. And they get on it, and ultimately they do figure out what the life cycle is. And now, the early symptoms, if you're lucky, when you're bitten by that deer tick, okay, you get a red rash. And the rash progressively gets larger. Okay, it's called a bullseye rash. The reason that it's spreading through the skin is that the spirochetes are moving through tissue. And as they do, they cause an inflammatory response. That's why we have that redness happening. Okay, but not everybody develops a bullseye rash. You might also have a really bad headache, a stiff neck, okay, dizziness. It does sound like meningitis, doesn't it? Okay. And then you have cardiac and neurological symptoms. My daughter-in-law works at CHOP, and she has had a lot of patients that have been in there because of heart block, that they needed to get a permanent pacemaker put in because the infection damaged the rhythm of the heart. And so the pacemaker stimulates the heart to contract normally. Okay, so it has a big effect on heart function and also on nerves. Now, you may have heard of people getting Bell's palsy, which is a facial paralysis. It's one-sided. Okay, so one side of your face is paralyzed. And so if you were to smile, that side of the face doesn't move, but the other side does. It looks rather strange. My son had Lyme disease, and one of the things that helped us diagnose it was the fact that he developed Bell's palsy. Okay, he had a very bad case of it because he did not get the bullseye rash, but he had terrible headaches. Okay, and ultimately the swelling in the brain was bad enough that he actually lost his hearing. So he's like 50, but he has to have a hearing aid because of the damage it did. He also, the dizziness was so bad that he was working in the operating room at the time. And not only did he have this dizziness where he lost his balance, but it also ultimately gave him carpal tunnel syndrome, swelling the hands, and he would drop instruments, okay, the surgical instruments, which wasn't a good deal, okay? So my brother-in-law is a dentist, and he developed the second stage symptoms of knee pain, joints swelling, and so that really affected his work, okay? But he finally cleared it. My son took quite a while before he got better from this, because it was not diagnosed, and then it was treated, but it was not treated long enough, okay? It's a rash that starts and it moves out from the bite like a bullseye. So every day that you look at it, it's bigger. Okay, and the reason is you have these red zones that are enlarging like a bullseye. Okay, and what it is the spirochete causing an inflammatory response in the host. And so that's what the redness is triggered by. Now, so